Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for Pathology. This class specially for TCM students. The book we used I put below here. I can help the students to study and review for the class. Okay, let's start. Now we're moving to next one. Next one we still say hepatitis, but reason cause is different. Now we're talking about some chemical kind of hepatitis, including the medication people use for long term, or maybe for some accidents people use a big amount, even one time. They still damage liver functions, cause liver infections. And the toxins, including any other chemicals, like alcohol. After people drinking alcohol, they will go to the liver to help to digestion. So that's basically we're talking about mainly drugs, metabolism, and detoxins. The organ is the liver. Anything like we eat, we drink, they will go to the liver. So for long term, like people got a long-term treatment with some special kind of medication, or maybe people use long-term eating or drinking special kind of chemicals, that will be damaging for the liver, injury for the liver. So this kind of injury, can come in from two aspects. One aspect is directly chemical, is directly toxin kind of stuff for the liver. Another aspect, our immunity systems will come in, like they know that's kind of damage in there. They try to help, but sometimes they make some severe kind of injury. So that's basically for the drugs and the toxin kind of hepatitis. So this kind of hepatitis, basically if we ask a patient, they will have like a history, long-term use drugs, or maybe long-term eating or drinking some toxin kind of stuff, and then we find the liver inflammation in there. And especially clinically, doctor will go get patients laboratory test, like no virus in there. So that's typically drugs and toxin kind of hepatitis, like without other reasons. So clinical symptoms for drugs kind of hepatitis, pretty similar like hepatitis like A, B in there. Patients still tired, still possible low fever, poor digestion, jaundice. Clinical symptoms pretty similar. The difference, no virus truly inside the body, and the patient use drugs long term, and use medication maybe long term. So toxin and drugs kind of hepatitis, we say they have two aspects. One is directly damage liver function, Another aspect is the immunity systems involved, and most severe damaged liver.